We good? Yes. Hello, YouTube. Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. Got off to a little slow start today because Facebook required that I re-authenticate my account. Thank you, Facebook. Not. It's always something, right? It's always something. Hello, Kim. Hi, JD. Nice to see you. We're simulcasting now live on Facebook and YouTube. When I'm looking this way, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. I see Kim and JD on YouTube right now. Welcome, welcome, welcome. Let me set the stage here for the things I wanted to talk about. Alrighty. Hello, Facebook. Facebook's always slow. Hi, Katie. Hey, girl. Nice to see you. Nice to see you. I'm here. Hey, it's a bit of a miracle. So last week we had a monster storm here in California. Monster storm. And the rain, we had flooding, and my internet was down. So I could not do a support group meeting. But I'm here today. It's a gorgeous sunny day here. In fact, it's so bright. I had to put paper up on my window because it was hurting my eyes. The other mistake that I made this morning. So like because I'm a pelvic floor patient like you guys are, my left psoas muscle has been spasming for a couple of days. So it's like right above my hip bone, that big meaty muscle that goes from your pelvic floor up both sides of your back. And so this morning I was just determined to try to stretch this out. And so I was laying on my yoga mat, trying all these positions and my roller and using my little tennis ball, trying to get this muscle to stop spasming. And, it helped a little bit, but then I thought, what? I want to be comfortable. So I slathered myself with Tiger Balm. And Tiger Balm is like Vicks Vapor Rub, but for athletes. And instead of having the menthol flavor, it has kind of a cinnamony scent. I've used it for years for muscle pain. Of course, you don't put it, you don't put it on mucous membranes. Like I will put it on my left hip, my left back, things like that. Anyway, I use so much of that, my eyes are still watering. So if it's a day. It's just a day. Hello, Connie. Anne says, hey, will topical estrogen stop nighttime frequency? Topical estrogen will improve your skin health so that your skin is not so reactive to foods that are triggering your nighttime frequency. So yes. All right, what's going on? One of my eyes is being weird. Is one of my eyes being weird? Last thing I need is a 4-hour recording with weird stuff. Okay, so remember the goal of topical estrogen is to improve your skin health. So I was working with a patient earlier. Hello, Lisa. Thank you so much for the 50 stars. Really, really appreciate it. And let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the U.S. National IC Support Group leader. I've been doing this for over 30 years. This is going to be my 32nd year of being a support group leader, which is crazy. I bring to you a lot of college degrees, but I'm also an IC researcher. I've done a lot of research. I've done a lot of writing. I sit on guideline panels. And so when you come to meetings, my goal in doing these meetings is to bring you factual information, because social media is so messed up right now. Social media feels like poison to me in a way, because it doesn't feel like it's a safe place, just personally and emotionally and psychologically. And in the IC world, social media is really, really confused right now. Hello, Debbie. Nice to see you. Because what we're seeing are people giving advice to people where there's absolutely no connection in their physical condition. Why? Because we're phenotyping. It doesn't make any sense for a patient with Hunner's lesion to give advice to a patient with pudendal neuralgia. It's misleading, it's discouraging, it's upsetting. If you're a newly diagnosed patient and you come into a support group meeting online and you hear somebody talking about how terrible their pain is, it's going to scare the living daylights out of you. But what you don't know is that person who's in very, very severe pain might have very, very severe Hunner's lesions, which you don't have. And we knew this 30 years ago. You know, every support group leader has to navigate a very distinctive challenge, and that is newly diagnosed patients as compared to grizzled veterans. Donna, excellent question. I'll get to that. Bad news. Newly diagnosed patients need hope. They need comfort. They need encouragement. Most importantly, you need education. Grizzled veterans need support because they're struggling. Of course, now we know why we have grizzled veterans. Patients with untreated Hunner's lesions are going to be in agony. And so whenever I was doing in-person meetings, I very distinctly, in my mind, separated these two groups. I needed to know who the newly diagnosed patients were. I needed to know who the grizzled veterans were. And you know, the worst way to start a support group meeting is to ask everybody how they are. Because for 30 minutes, we will have story after story. And it brings it down. And so whenever we did intros in my groups, instead, what I said is, can you please introduce yourself and give us your best flare management tip? And we'd write it up on a whiteboard. And so at the end of these intros, at the end of this intro, I would have a whiteboard filled with 30 great flare management tips in 30 minutes, for which my newbies could use right away. So instead of starting the meeting asking people how they were doing, because you know you're there, we know you're flaring, we are going to start the meeting with something really useful and encouraging, because we have knowledge to share. We have knowledge to share, but we have to do it in the right context. Katie said she tried to email me, didn't go through. icnetwork@map.com. Email me again. Guys, the rule if you're trying to reach me is be the squeaky wheel. Over and over and over again, because I get bombarded. And even better, put your subject line in capital letters. I don't consider that yelling. That's a great way to get my attention. So my goal in doing meetings like this is to try to give you balanced, accurate, real information. There are a bunch of groups on Facebook. There's a group on Reddit. There's a group on the IC network. There's groups all over the place. There's groups on Inspire. I mean, honestly, I just don't trust any of them at this point in time. Well, trust isn't the right word. I don't think they lay a fair foundation to help you understand and interpret the information you're getting. And ultimately, it begins with trying to identify the underlying cause of your symptoms. Like, I think we need a separate group for Hunner's lesions. And I should start that if I had time. We need a separate group for widespread pain. I'm actually building a website on that. I've already built a website on Hunner's lesion. We need a separate group on estrogen atrophy. I've already done that. And I'm bringing on a social media manager now. Stacy's going to be our new social media manager, so we're going to be able to do a lot more. But you know, it's been a ride, because I'm still recovering from surgery and all that sort of stuff. I'm having a very difficult recovery from surgery. I ended up breast cancer surgery, crying all day Friday. But they were happy tears. It was weird. It was just like, I just had to let it out. It's just been rough. Okay, so when I do these meetings, I'm very human. Nothing is off the table. I'm willing to talk about anything. Nothing will embarrass me. And we're going to start with a little 30-minute intro. I'm going to be talking about two things. and then we're going to take your questions. And Donna has a very, very important question here about all the changes in the government right now that's happening. And is that going to affect the ICU world? And I pray it doesn't. I pray that we will still have our IC research. I have been invited to participate in a new federal study on IC. It's something that I've worked for and hoped for a long, long time. And now we have no communication. So we don't even know what's happening right now with the federally funded IC research. I'm just telling you that right now. It's very, very upsetting. Okay, so we're going to talk about two things first. Okay. Notice my theme, love. And what is this? I have a bottle of wine right here. Wine and IC? What? Jill, why would you be talking about wine and IC? Well, hey man, Valentine's Day is less than a week away. We need to make a nice setting because your relationship is important. We want to celebrate your relationships. Problem is that a lot of things that we would normally enjoy on Valentine's Day can trigger flares. The most common of which is wine. Unless, if you look at the heading, alcohol removed wine. There's no alcohol in this bottle of wine. Now, I'm dry this year. I'm dry this year because I'm recovering from cancer. I've not had any alcohol in over a year. But these new alcohol removed wines are gaining a lot of traction here in the wine country. I mean, like, I live in the California wine country. I have worked in wineries. My sister is a winemaker. I love working in tasting rooms. They're fun. But when you have IC, literally one of the worst flares of my life was from drinking like a shot glass of champagne 25 years ago. Oh my God. I was up all night crying my eyes out. Now my bladder has healed. We have found the underlying cause for my issues, which was not a bladder disease, but in fact, pelvic floor dysfunction. And now that I've done the proper physical therapy and we've got blood flow restored and my bladder has good blood supply and it's been able to heal, I don't have diet restrictions anymore. I drink lemonade almost every day now. Granted, it's very dilute, but I still drink it. I couldn't have done that. I hadn't had lemonade in 29 years. So I have been playing just for fun with alcohol-free wines. Here it is. Now, I'm not a fancy palate kind of person. I like really simple wines. I am not a wine snob in any way, shape, or form. What's cool about this wine is it's not like grape juice at all. Some of the alcohol-free wines taste like grape juice. This comes from real wine grapes. This was wine where they actually removed the alcohol. It has a very light, it's very light on the palate. It's very light on the stomach, very light on the bladder. Very, very refreshing. I was talking with my friend a couple, like 2 weeks ago. And I said to her, you're not going to believe what I did. I drank half a bottle of wine. And she's like, what? Jill. And I went, well, it was alcohol-free wine. It was good. Okay, so for Valentine's Day, wine side, Debbie, girl, if you lived out in the wine country and you actually went to the wineries, believe me, there are many wine snobs out there. They drive me batty. And I actually really, if I were to drink alcohol, I would be drinking a hard cider. I wouldn't be drinking wine. I like hard cider. I like fruity wines more than I like kind of Cabernets. But give me something that's slightly fruity and I'm going to be more inclined. But again, I'm alcohol free. I'm absolutely alcohol free. Lori, hold that thought. So for Valentine's Day, I suggest this brand, Free, F-R-E. And then there is a sparkling wine that's called, I think it's called Zilch. That's alcohol free. That was also quite nice. Quite tasted great. Didn't irritate at all. But again, I don't have Hunner's lesions. I don't want you to do anything that's going to irritate a Hunner's lesion. I mean, listen, last thing we want to do is make you flare on what's supposed to be a really lovely partner day. And so back off on the champagne, the traditional champagne. If you want to try something different, go for something that's de-alcoholized, okay? I mean, I'm really enjoying myself doing it. And frankly, at the end of the day, it's kind of like a cup of coffee. You have a cup of coffee to kind of just sit and relax, or a cup of tea. But then after dinner, it's just kind of nice to sit back and breathe and have something different. And this de-alcoholized wine does everything from a stress management standpoint that a regular glass of wine would do. It just gives you a moment to pause and enjoy something that tastes good. Yeah. And Debbie says nothing wrong with toasting water either. Absolutely not. Now for chocolate, listen, chocolate is a trigger. Chocolate is highly neurostimulatory. Chocolate usually has caffeine in it also. Chocolate is known for triggering migraines. Chocolate is known for triggering IC flares. Chocolate is known for triggering IBS flares. I called them bend over and screamers. I don't know what it is, but as a former IBS patient, but my nerves are, I'm also a widespread pain patient. So the nerves in my bladder and the nerves in my bowel and throughout my body are quite sensitive. When I was in my 20s, I had terrible IBS. And I struggled with food sensitivities. It was eating certain foods that were triggering problems. And it turned out that once I did an elimination diet, I was able to figure out that the oatmeal I was eating every day was triggering massive diarrhea and cramping, but so was chocolate. And once I stopped the chocolate and once I stopped the oatmeal, the cramping stopped. So there's a lovely workaround. If you can't do the chocolate, go to carob. The carob today is fantastic. It's so good. Now, 30 years ago, 40 years ago, carob was dusty and dry and nasty. That's not the way it is anymore. Carob today is just like custom chocolates. It's so good. It's rich, it's creamy, it's flavorful. So if you have a market that sells carob, you can go buy carob chips. You can go buy carob candy. There's wonderful carob on Amazon. Caribou is a really, really good example. Missy J's carob is a really, really good example too. So you can have a little bit of sweet too. But we have to talk about the monkey of the day, and that is intimacy. Now here's the challenge here. Valentine's Day comes with a lot of mixed messages. Number one, it's highly commercial and it's really offensive from that standpoint. Number two, we have a lot of expectations over Valentine's Day. Some of us have had lovely Valentine's Day that we will remember for the rest of our lives. Others have had terrible Valentine's Days. I broke up with the man I thought I was going to marry on Valentine's Day. I didn't like Valentine's Day for many years after that. And I don't even know, I still to this day don't even know why we broke up. We just broke up. He had terrible timing. If we're going to look at the purity of Valentine's Day, it's about celebrating love. It's about celebrating the people in our lives. It's about recognizing them in a sweet and joyful way. My mother, to her dying day, always had a special dessert for my dad. When she could drive, she would always go to a bakery and get something lovely for him. He would always forget. He wouldn't give her things. She always gave him things. And then as they both got older, I stepped in and I got them both things. um, then I want to tell you the story of Chuck and Joanne. Chuck and Joanne were very, very good friends of mine. In fact, I built their first business website. They were artists. They were also members of my support group. Joanne had very, very severe IC. Chuck was the most delightful partner ever. Like, imagine walking teddy bear. That was Chuck. And one day they came to a meeting and they were fighting. It was really obvious that something really upset both of them. And to the point that it disrupted our support group meeting. And I always have a rule as a support group leader, and that is the minute anybody starts crying, I start talking and we start working with the person who's crying. I can remember the room. It was at Petaluma Valley Hospital. I can remember looking at her face, and she looked shattered. And she said, so I stopped the meeting and I said, Joe, what's wrong? What's going on? She said, he doesn't love me anymore. He won't even touch me. He won't even give me a hug. And Chuck, the teddy bear, looked at her with tears in his eyes and said, honey, every time I try to hug you, you push me away because you say it hurts. The reason why I'm not touching you is because I don't want to hurt you. I love you. I don't want to hurt you. And then he started crying and she was crying. And she was kind of like, a little bit on the upset, angry side. And she said, you should know when I need a hug. You should know it. And he's like, how? How am I going to know it? When you don't even tell me it's okay. Every time I've tried, Joe, every time I've tried, you push me away. So I stopped trying. This is a lovely, lovely couple. I adored them. And I turned to Joe and I said, is that true? Do you push him away? And she goes, of course. Yes, it hurts. So you push him away when he's trying to hug you. Yes, it hurts. And I answer to her was, well, then how will he know when it's okay to hug you? He can't read your mind. He doesn't know when you need a hug. He has no clue when you need a hug, Joe. You have to tell him, honey, I'm having a terrible day. Could I get a hug? Please. Can I just please have a hug? Never dawned on her. It never dawned on her that she should initiate it. She was thinking he should read her mind. And I was, this time, you remember, there's like 40 people in the room. And this is a very intimate discussion. And I'm sitting there going, oh man, I got to handle this right. I don't want to offend anybody here. In the end, I had them hugging and kissing. And we created a new rule for them. And the new rule was nobody is expected to read anybody's minds anymore. That if you need a hug, you need to ask for a hug. And for Chuck, honey, if you want to hug her, ask her if it's okay. Honey, would a hug be okay right now? How about a kiss? And they walked. I mean, I'm really, really convinced that it saved their marriage, because they were together to the very, very end, and they have both passed away now. Such is a conundrum of IC, pelvic pain, and Valentine. The tragedy of Valentine's Day is it sets up a crazy expectation for wild athletic sex. Well, what if you have pelvic pain? Would you try to have wild athletic sex if you have a broken hip? Of course not. So why are you trying to have wild athletic sex when you got a broken pelvis or broken muscles or a broken bladder? I just put up a blog on our website that talks about Valentine's Day, kind of in depth. And I have linked in that two wonderful handouts from a sex therapist. Her name is Dr. Heather Howard, who talks about how to build our relationships when one of us has pelvic pain. And I actually have I have a really funny story I could share, but we're kind of going into territory that people don't want to talk about, and I don't want to push this on you guys. So the first one is this one: reduce sexual pain, a new way to look at sex. And she had some good points here. Does sex make you feel sad and alone? Well, with chronic pelvic pain, your body can change every day. This is like any other injury. Stress, hormones, allergies, infections, medicines can change the place and type of pain or pleasure you might feel. Something that felt good yesterday could hurt today, and something that hurt yesterday could feel good today. This is very confusing, and sex can feel very scary for you and your partner. And you both might feel sad and alone, but you're not alone. Many couples living with pelvic pain feel just like you do. They say things like, when I think of sex, I think of pain. I want my partner to touch me, but I'm afraid of any touch that will turn into sex and hurt. Instead of bringing us closer, sex usually ends up with both of us feeling bad. It seems like every place I touch is wrong. I'm afraid to hurt my partner. Hello, Chuck. And when I try to touch my partner, they push me away. And she has really, really good tips on what you can do to reconnect. Like, for example, sex isn't something you do. It's a way to connect and learn about what feels good. Anyway, this is a lovely handout that you can get through our website right now. And then here's another one on specifically how to reduce pain and to bring new comfort and joy into your relationship, despite the fact that you might be struggling with pelvic pain. I'm just going to leave you with one important point. And this is something I've been saying for 30 years. If your partner initiates intimacy for Valentine's Day and you're in pain that day, you have the right to say no. It is okay. But you have to be really careful the message you're giving, because you're not saying, no, I don't love you anymore, which is the way your partner might interpret that. What you do need to say instead is, honey, I love you so much. I would love to be intimate with you, but right now, my bladder is on fire. My pelvis is on fire. So not right now. But maybe there's some other things we can do instead of intercourse. So when you're saying, and if you're the recipient of a no, if your partner says no to you, It's very important that you respect the fact that your partner is in pain right now. Now, listen, there are some patients that I've been worked with, tragically, there are some patients who have been forced to have sex, literally forced, despite agonizing pain. And that's a real challenge because they do not have the resources to say no for one reason or another. There are others who will say yes to sex, but they have to take pain meds before and after sex. That is your choice. If you have access to pain meds, that's something that you can do. But fundamentally here, the reason why we're doing these meetings is to help you understand underlying causation. Because most sex pain is from your tight pelvic floor muscles, injured pelvic floor muscles. And if we can heal these muscles, if we can get you into the right physical therapy, if you're willing to do the work, do the physical therapy, there is a very, very good chance your muscles will relax and release and you'll be able to be intimate again. It is your choice. It is your choice. But we're long past the days of condemning you to a life of misery, saying that this is an incurable bladder disease. We know this is not a bladder disease for most of us. This is a pelvic pain syndrome for which there are many potential causes. Now, I will tell you, I was working with a lady a couple of days ago who had a lot of pain with sex. And so we're kind of going through kind of the symptoms. I'm working on phenotyping her, trying to understand underlying causation. Her case was very interesting because she could sleep just fine. She had no problem sleeping. None. And I'm like, okay, if you can sleep through the night, then that you're not an IC patient the way we normally see IC patients. Because if you had a bladder wall injury, you would not be sleeping at night. In fact, your worst symptoms would be at night. She goes, no, I can sleep at night just fine. It's like, okay, when does pain start? In the morning. As soon as I get out of bed. Okay, tell me about that. Well, it just gets worse and worse and worse. By the end of the day, I'm in agony. It feels heavy. Feels heavy, Jill. Knew exactly what that was. That's pelvic congestion syndrome. She's got a varicose vein in her pelvis that is collecting blood, pooling blood. And that's what's causing that heaviness and that daytime pain. So in her case, I think for things to calm down and to get comfortable, for her to even try to have sex in the middle of the day, impossible. She's got a very, very painful pelvic congestion syndrome. Might be able to do it in the middle of the night. Hard to say. It's hard to say. We have to be open. We have to be open. And we have to relearn trust. I can remember my first year, I just said to my doctor, I was 33, I was like, I don't think I can have sex. He goes, I don't think you can have sex either. I went, how long? He goes, maybe a year. I was like, I will do anything not to be in this pain. My pain was so severe back then. Saying no to sex was super, super easy. But that's not normal. And that's depriving each one of us of touch and comfort and physical affection and something as simple as a hug and love. And there comes a point in time where we have to regain some confidence in our body. And that's not something your partner can do. That's something you have to do for yourself. And we can talk, that's the big M. But anyway, that's a whole nother story. So anyway, you are not alone. You have lovely people in your life who love you. I want you to show them your love in as many ways as you can. If you want to make cookies, make cookies. If you want to go buy flowers, buy flowers. If you want to hug, go for it. If you want to kiss, go for it. If you're feeling good enough and you want to try intimacy, go for it. Be slow, be gentle. If something hurts, back away, try something else. But ultimately, in the end, it's just one day. And let's not get all upset about one day. If it doesn't work, it's fine. You will have other days. So anyway, that's my 2 cents about Valentine's Day. You can come on over to the IC Network. I've got a great blog on it. I just put up. Okay, we got a lot of talk happening here in Facebook. Yeah, there's one other thing I want to talk about. We're going to talk about one other thing, and then I'm going to take your questions. So our magazine is at the Typesetter. It's looking awesome. They're a really good IC Optimist magazine. One of my lead stories in the magazine is a new study that came out that proposed a new phenotype for IC. So you got to remember, we focus on 3 or 5 phenotypes, and that is going to be Hunner's lesions, a specific group with their own treatments, and we got bladder wall driven. It's just going to have estrogen atrophy, chemocystitis, and that. We got pelvic floor driven, patients whose symptoms are being caused by muscles. We've got widespread pain, which is the IC, the IBS, the vulvodynia, etc., which is caused by the central nervous system. So each of these groups has its own treatment. And this is fantastic because now we're helping patients find the right treatment. We're not wasting your time anymore or your money doing treatments that don't have a bat chance in hell of helping you. The new proposed phenotype is ligament laxity, also known as posterior fornix syndrome. So follow my line of thinking here. This is very interesting. So we had a case study a couple years ago of a woman with severe Hunner's lesions and a prolapse. And when they went in and they repaired the prolapse, they discovered that her uterus was backwards. It had flipped around. And it had flipped around because one of her ligaments, her US cell ligament, was broken. So her uterus was free swinging on one ligament. Okay? So when they go in to surgically repair the prolapse, they find this crazy out of place uterus. And they're like, wow, okay, that's unexpected. So they untwist it, they fix it. They fix the prolapse. They get everything back into its proper position. And guess what happened? Her Hunner's lesions healed completely. She is considered a complete and total cure. And that really stunned the urology IC researchers, but it didn't stun the ligament researchers. Those guys have been talking about how this ligament, if it's damaged, will cause bladder symptoms and pelvic pain for a couple of decades now. I think they discovered this in like 1993. I think it was 1993 where they made this discovery. And so the anatomy experts were like, hey, man, if this ligament is broken, it will cause massive problems. Okay, why? This is where it's so interesting. And it's about body, it's about position and structures. So the uterosacral ligament holds the vagina and the uterus in place. And men have a US cell too, okay? When that ligament is damaged, it is no longer providing the structural support that it needs to provide. And things start to move. So imagine falling. It's falling. So this frame is now broken. But the question is what is it holding up? It's not only holding the vagina and the uterus in place, it's holding something called the visceral plexus. It's holding a bunch of nerves in place. And these are afferent nerves. These are nerves that come from the bladder, that come from the vulva, that come from the bowel. They merge together and then they go up to the spinal cord. So here's our bundle of nerves, and here's the ligament. Actually, we should do it this way. So here's our bundle of nerves. Here's the ligament. The ligament falls away. What happens to the nerves? They fall. Gravity pulls them down. Gravity stretches them out. It's fascinating. So when you go from sitting to standing, we've got gravitational forces pulling these nerves out of position. If you're walking, every step you take pulls these vital urinary nerves. So what happens then is that the nerves get super, super inflamed. And they start generating their own nerve messages. They start yelling to the spinal cord and yelling to the brain, help, 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 something's wrong, something's wrong. But these nerves, the way they communicate that, well, let's say that's not the right way. Okay, so these nerves are firing independently of the bladder. The bladder is not firing. The nerve bundle outside of the bladder is firing. And it's sending messages up the spinal cord to the brain, help, 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 help. The brain interprets these messages as coming from the bladder wall. The brain hears or interprets urinary frequency, urinary urgency, urinary pressure. So here we have the brain thinking there's a problem with the bladder when there's no problem with the bladder at all. It's a problem with the ligament that is not providing the right structural support to the nerves coming from the bladder. So we now have, I think, 3 really large studies. And one of the things they look for is, I see patients with a history of prolapse. Because if you have vaginal prolapse, that could be a sign that you have a damaged ligament. And in one study, I think it was in 2022, and I think the researcher was Boshin, I think. In all of those patients, when they repaired the ligament, the bladder symptoms went away completely. I find this very, very exciting because you are an anatomical mystery to be solved. And if you're not responding to bladder therapies, as so many of you don't, I never did, that's when we have to look outside the bladder. So the cool thing here is it's super, super easy to check for a broken ligament. I mean, like literally all they do is they stick a speculum into the vagina where that ligament is. So they stick it, it's called a fornix, which is a little pocket by your cervix. They stick this speculum up there. So here's the fornix, here's the speculum, and they just lift. They just gently lift it. And if by lifting it, that makes your pain go away, and makes some of your symptoms go away, you have a damaged ligament. Posterior fornix syndrome. So I do believe that this is a small phenotype. I think that, and remember, another cause of Hunner's lesions is viral infections. I think that group is bigger than the broken ligament group. But the bladder can be injured in many different ways. And now we understand how and why ligament injuries can trigger urinary symptoms that are relentless. And so, again, if you're not responding to therapy, if you're getting worse rather than better, what do our national guidelines say? Our national guidelines say stop what you're doing, take a step back, revisit the diagnosis, and let's see what we could have missed. Let's see what we could have missed. What we don't want is we don't want you to be on medications which have no chance of helping you. And I think at some point in time, you have to ask yourself, let's just say you were on Elmeron or you are on Elmeron, but you still flare a lot. If you're still flaring a lot, it's probably not helping you. And again, what our guidelines say is if you're not responding to therapy, if you're getting worse rather than better, you take a step back, revisit the diagnosis. Let's see what we have missed. So anyway, in our magazine, this is one of our big stories, is this new proposed phenotype. And I'm quite excited about it. And so I'm going to push it. You know, I am kind of embracing my role as a rebel right now. It's amazing what a cancer diagnosis does for your mental health. I will be very honest and share that I have been dealing with a lot of anxiety. And so I started therapy and I'm loving it, and it's been really, really helpful. Really, really helpful. I had two images I can share with you. As I was trying to describe how I felt like I was standing on a cliff, the cliff of cancer, and that I was holding a quilt around my shoulders, but it's very battered and torn and ripped. And that each square in my quilt was a moment in time. There were good memories, happy memories, and there were very sad and angry memories in my quilt. So as you know, the therapist was kind of guiding me through this, and it just kind of came to my mind. I feel like I'm standing, I'm vertical, but I'm tattered. But then something absolutely remarkable happened. And that is the recognition that I'm a quilter. I can quilt like a beast. I love to sew. And as I was standing on this cliff, looking down at my quilt, going, I can fix this. I know how to sew a quilt back together. And it's okay if it's not perfect, because I'm not perfect. But then the other real big revelation was, you know what? And I can redesign this quilt. I don't have to carry around some of this stuff anymore. That quilt, about that guy who hurt me, gone. That square, gone. I don't need you anymore. I'm not going to carry you anymore. And it was kind of a revelation to me that I realized that I have carried so much, too much. And like any quilt, I can cut a square out and let it go. I can cut that memory that's haunted me for so long, and just, you're done. It was just remarkably freeing. Then we were talking about the anxiety. 'Cause I have a lot of medical anxiety right now. Like, I don't even want to open my email because it's like, what the hell is going to happen next? That too much happened. And I was standing on my safe place on the hillside in the sun. And she said, what does the anxiety feel like? And I said, it feels like I'm covered with a really thick layer of motor oil. It's like there's this heavy, thick weight of oil that's just covering my body. You know, and I was crying. I mean, this was like a week ago. I was crying, going, I can't get away from it. I can't step out from under this. And she's like, can you wash it away? And I went, no, it's oil. Water doesn't push oil away. So she was kind of going down that pathway. And I'm like, hello, scientist here. Yeah. What gets rid of oil? What will melt oil? Heat, sunshine. And so we did this incredible visualization where I imagined that I had kind of like Katy Perry's firework song. You know, we all have fireworks, kind of this beautiful soul energy that goes out and our soul strings that connect to other people. And so what I did, which she walked me through, was have me visualize this part of my body as getting progressively brighter and brighter and brighter and brighter and warmer and loving and comforting and wonderful. And you know what happened? The oil moved away. It pushed the oil out. It pushed the anxiety away. But it didn't just push it away, it melted it. It's amazing the power of visualization. And for the rest of the day, I felt so good. Like all of my fears about cancer, everything was gone. And then I woke up in the middle of the night at 4 a.m. looking for my light, and I couldn't find it. But then I did find it. I did find it. And so I share this with you to tell you that I have the same fears that you do, but I really am absolutely loving therapy right now because there's nothing better than talking to somebody who like literally is not involved in your life and doesn't know you and has a depth of experience that can really help. And when I was at the doctor's on Friday and I was dreading it and I forgot my purse and I didn't have my medical card, you know, just the anxiety was off the charts as I'm driving to the hospital. I have like the best freaking appointment of the year. My blood pressure was awesome. My blood pressure's been out of control. It was 135 over 75. Yeah, baby. And she listened. She listened. And I got really, really good advice. So if you're struggling with anxiety, as I have been struggling with anxiety, don't do it alone. I signed up for betterhelp.com, the online service, but I also have a trauma person through my insurance that I've been working with. It's been a good investment for me. So anyway, that's a little bit about me. I'm not going to talk about me anymore. Let's talk about you. Okay, alcohol-free wine. Alcohol-free wine. This is not going to be a flare. This is a celebration. Things are getting better. Finally. Oh, and the most amazing thing. Okay, guys, the most amazing thing. So getting back to standing on the cliff with this bright light, kind of this healing energy. And here I am bawling my eyes out going. And I swear my mother appeared on my right shoulder and added her light to my light. It's like I like literally felt her. And then I looked the other way in my mind and my aunt was there and they were both building my lights. And it was just lovely. Just lovely. Okay. Like I said, I'm willing to talk about anything. Let's go to your questions now. Donna says she's getting ready for a trigger point injection. This is for the pelvic floor. You go for it, girl. Janelle says, I was invited to join a 12-week program to help with pelvic pain. It will teach me to do correct breathing. The cost is $1,200. Hell no. You don't need to pay $1,200 to learn that. There are people online right now selling programs for thousands of dollars that they say will help you and cure you. You can literally go to YouTube and search for diaphragmatic breathing to learn the breathing technique for free. You don't have to pay anybody $1,200. That frustrates me. I mean, listen, if you're rich and you can afford it, power to you, go for it. But most people can't afford that. And so think instead about what are they talking about? They're talking about diaphragmatic breathing. They're talking about learning how to calm your central nervous system, especially if you have widespread pain. Um, they're not going to be able to offer physical therapy. If you've got tight pelvic floor muscles, girl, you got to put your money into physical therapy. That $1,200 needs to go to a physical therapist. Nobody online can fix tight pelvic floor muscles. Judy says, saw you last week talking about bladder neuromodulation. My urologist said they have a device they can implant above the ankle. That is the Urgent PC, although they have a new device that's way better because it doesn't come with the significant risks of adverse events that the spinal sacral pudendal neuromodulator, neurostimulator comes with. But they can start just with an acupuncture needle. There's no reason for you to have surgery. There's no reason for you to have a piece of foreign plastic or whatever put in your body. Test it out first with an acupuncture needle for 10 treatments. That's the protocol. Heather says, been watching you for years, been struggling with painful bladder syndrome for over a decade. I've had a series of installations. They all made me worse, wondering if that's Hunner. Heather, it could be. Has anybody looked in your bladder? And if they have, what'd they find? Have you had a cysto? At any point in time in the last decade, 20 years, has anybody looked in your bladder? And if they did, what did they find? Shemper said, Donna says, where do we purchase the wine? I get mine at Safeway, our local grocery store. Most grocery stores who have wine now have a small de-alcoholized section. So just play with it and come back and tell us the wines you try. I've tried some wines, some de-alcoholized wines that were just no better than sparkling apple cider. But like this one's really good. So go figure. I love you too, Donna. Sisters forever. One day we're going to meet. One day. Hi, Diane. All right. Okay, so let's go to Facebook here. Hello, Facebook. Okay, so you guys on Facebook, just so you know, it scrolls by quickly. If I missed a question, don't take it personally. Ask it again. Just be the squeaky wheel here. So like right now, it's just like not letting me scroll. Okay. Come on, computer. Vicky says she's losing her mind, but I can't scroll back to Steve Y. Come on, Facebook. Here we go. Pamela, I've been in the bathroom for days, can't hold my urine at all. Today is worse with diarrhea. Okay, Facebook, stop it. Just when I'm reading something, it scrolls. Okay, guys, I'm trying. Hold on. Okay, for you guys on Facebook, do me a favor. Can you stop typing in the chat? Just for 2 minutes. Stop typing in the chat so I can read it, okay? Because every time you type and enter something, it resets me. So just let me try to do this here. Well, okay. Please ask your questions again. It's sending me back for like 2 seconds and then I can't finish reading it. Okay, my orthopedic doctor sent me for an MRI, then back to the, damn it. See, like literally I'm getting 8 words and then it resets me. Could be back issues, bladder, hip, foot swelling. Hmm. So it looks like Pamela's struggling with incontinence right now. Incontinence. And she's having MRIs or looking at her hips or looking at everything else just to try to figure stuff out. Hey, listen, I'm all about having a good diagnostic workup. I have no problem with that at all. Um, Normally, incontinence implies that you have very weak pelvic floor muscles. And so, our question here is what's going on with your pelvic floor? Have you had a proper pelvic floor assessment? Lori says chocolate's her worst enemy. Mine too. I won't touch it with a 10-foot pole, but I can eat carob all day, which is why I don't have it in my house at all because I will eat it. Somebody said wild sex, forget that. Yeah, well, if you have a broken hip, it's impossible. If you have a broken bladder, it's possible. Harriet's making a note of ligament laxity in her IC 101 book. Lori says Valentine's Day is a sad day for me and people who were left behind because they had pudendal neuralgia and IC and all those things when they were 57. Lori, same thing happened to me, girl. You know what? But here's the deal. At some point in time, that gentleman is going to have a prostate issue because that's what happens as men get older. And there will come a time where they will be running to the bathroom all the time, potentially. And that is the moment when the light bulb will turn on and they will go, oh, I didn't understand. Not that it makes it any easier for you now. Didn't make it any easier for me too. Harriet says she now sees the importance of phenotyping. It directs treatments. Exactly. Debbie says, I have a cystocele. Let me tell you, my bladder is so bad. It's probably the ligament. If you have a cystocele, then you have a structural abnormality, and they've got to figure out why. And Debbie, you absolutely should get tested to see if you have a damaged ligament. Nancy says, I'm supposed to start a hormone blocker. So nervous. It gets tricky. Any hormone blocker that blocks estrogen puts you into an early menopause that can affect your bladder. Nancy says she's putting a binding on a quilt today. Nice. I like to make my own quilts. I don't follow anybody else's pattern. I just play. Harriet said, this is what I did with my care. I said in 2025, I will be assertive and learn and grow and connect with a progressive, informed provider. I found one and she gets it. Yeah, baby. And the thing too is that we have to understand that our trust in the medical system has been damaged badly. And God forbid you be insured by United Healthcare. The stories ever since their CEO was assassinated and by a former patient who apparently was denied service, and lots of other people are sharing their stories too. And I've been following this surgeon online who literally specializes in breast cancer. She had a patient on the table she was operating on, and United Healthcare called her in the middle of surgery to question why that patient needed to be in the hospital that night. Pulled her out of the operating room. There was another surgeon in there. And then this person who had no medical background, who had not read the case notes at all, said, why do you want her to spend the night? And the surgeon goes, because she's having a very complex surgery. This is not a simple outpatient procedure. She needs to be in the hospital overnight. And she thought she'd made her case, completed the surgery, patient spends the night in the hospital. After they're done, she just posted it again. United Healthcare denied it. And then United Healthcare sent her a legal letter saying she shouldn't have talked about it online. And she posted this, you know, I'm going to speak up video. I'm not going to submit to these big companies that are making billions off of people and help. And the ramifications being that some patients are suffering and some patients are dying. No. So if you follow me on Twitter, I just reposted that video. She's awesome. I wouldn't trust United Healthcare at this point in time. I can't even imagine what they would be doing with IC treatments. I don't know what they're doing with IC treatments. You'll have to tell me if any of you have it. But I mean, our challenge here is our trust has been shattered by a lot of different companies. I'm part of Kaiser Permanente, and I have to say my care has been excellent. But I have paid them. What am I paying right now? Like, I think we pay $3,500 a month for 2 of my employees, and I'm one of them. I don't know what we're going to do when we get older and we don't have income coming in. Yikes. Dawn said, my physical therapy modified my exercises so they don't irritate the pelvic floor. Excellent. Harriet said she started therapy for IC pain and anxiety on Tuesday. Good job, Harriet. Well done. Debbie said, hold on. That's my business phone, and it plays Greta Van Fleet, a rock band from Michigan, because I can hear it. Debbie says, doctor said fixing my bladder prolapse would be a nightmare. How can it be any worse than it is right now? What if anyone has had a bladder prolapse, and what have you done? So Debbie, you need a second opinion. If you have a doctor who is just basically saying that he doesn't want to do the surgery because it'll be very complex, maybe you need to go to a more experienced urologist or gynecologist. So I would say ask for a referral and a second opinion. Debbie said, if a cystoscope showed pinpoint hemorrhages of that IC, no, that's been removed from our guidelines. Pinpoint hemorrhages or glomerations on the bladder wall, we all thought was IC for about 25 years. Now we know they happen as a result of just doing a hydrodistension. They are not unique to IC. That is what happens when you stretch the bladder. And back in 1987, when the first research guidelines for IC were released by the National Institutes of Health, they required either Hunner's lesions on the bladder or petechiae, petechial hemorrhages, glomerations on the bladder, to admit one of these patients to an IC research study. But within 6 months, another doctor did a study, and he had like, I don't even remember how many patients. It might have been 30 or 50 who were scheduled for a tubal ligation. And he said, hey, would you mind letting me look in your bladder? They had no bladder symptoms at all. They were scheduled to be under anesthesia for a tubal ligation. And he proved that when you stretch the bladder with water, it causes petechiae. And so we've known this for 25 years, that petechiae are not meaningful. But they just got formalized in our guidelines in 2022. They are not unique to IC. Carrie said, I've been flaring from physical therapy, working on my core. I've had pelvic floor physical therapy in the past. That's very common, honey. And so when you flare after, I mean, I interpret that 2 different ways. Listen, the great joys of having a pelvic floor assessment in the first place, that very, very first appointment when they're doing that internal exam and they have a finger in your vagina or in your rectum and they are touching muscle. If they can touch a muscle and trigger your pain, that is what I call your hallelujah moment. That is so exciting. It's like, that's it. What are you touching? Please tell me, what are you touching? So pain at that first appointment is revelatory. It's like, wow, this is cool. Jill, it's your piriformis muscle on your left side. Oh, okay. Now we know where my muscle issue is. Now, at the follow-up appointments, that physical therapy should be adjusted so that they start working with that muscle constructively. They're going to work on lengthening that muscle. They're going to push on trigger points. If there's a tight muscle trigger point, they might work on that, massage around it a little bit. Sometimes they do something called strumming, where they go across the muscle instead of the length of the muscle. And these muscles do respond fairly quickly to direct massage. And they will, the problem is that these muscles sit on the bone, but when they get tight, they lift off of the bone. And when they lift off of the bone, they start interfering with the bladder and everything else. So our goal here is to get them to relax and release and get back down on top of that bone. And usually that's very, very quick. A couple of minutes. At least it is for me when I do my internal work. The key question you have to ask your physical therapist after your third or fourth appointment is, are my muscles responding to physical therapy, or are they always locking back down into tension? If your muscles are always getting tight a week later, a day later, a month later, that's important. That doesn't mean that the physical therapy isn't working. What it does mean is that there's something else happening in your pelvis which is putting stress on these pelvic floor muscles. It could be a tailbone that's pushed out of position. It could be an SI. Mine is from my SI joint. My SI joint moves too much, so my muscle locks down tight to stabilize the joint. It could be from a bad hip. It could be from a bad knee if you're limping. And it could be from your ankle. And I was working with a patient this week as we were going through this. His muscles were always tight, and he was very frustrated. He didn't understand why physical therapy wasn't working. We started talking about bones, and we finally got to the feet, and he goes, oh, yeah, I have a lot of foot problems. No, is that interesting? And it's like, you don't by chance have an ankle that's rolling in? He goes, yeah, I do. And I went and then I showed him the picture of what that does. That stretches the pelvic floor out on one side. So if that physical therapist is saying your muscles are always locking back down into tension, we kind of have to you still have to work with the muscles because they're under stress, but we got to take a step back and try to figure out why those muscles are so stressed. And usually that relates to bones. And in 90 to 95% of those patients, it's coming from their feet. There's a problem with how they're walking. So you need to tell your physical therapist that it's flaring you and they need to back off a little bit, but don't be afraid of physical therapy. Muscles respond beautifully to physical therapy. Okay. Don't be afraid of it. Just go back and have a conversation and tell them exactly how you felt afterwards. Like for me, I personally have never found physical therapy painful. And I'm one of those people where I giggle. Like literally, if anything weird happens, I giggle. At the chiropractor, and I don't like chiropractors, I just giggle. Physical therapy, I giggle. But they're always watching your face, and they can see when you grimace. And it's like, oh, okay. I felt the effects of physical therapy after I put my clothes on. And I started walking to my car. And as I'm walking, I'm going, oh, yes, we have worked with these muscles. And the worst moment for me, when my muscles used to be really, really messed up, was sitting in my car. The act of sitting on these muscles was the first couple of times I cried. And I went home and I took some Vicodin and used a heating pad. But once you kind of get past that and the muscles slowly heal, that usually goes away. Janelle says, you're absolutely brilliant. Thank you, honey. I gotta say, I'm having a good day today. Even if my hair is a little weird. I just washed it, but it's all weird. Anyway, this is part of my rebellion. I'm the redhead with the long hair standing on the cliff wearing a blue gown and the wind's blowing and my hair is stretched out behind me. That's how I'm visualizing my fight against breast cancer right now. Arrgh. Okay. And to regain my normal life, I just want to be normal again. Sherry says, I have United and they've covered everything so far. Good. I'm so glad, Sherry. And that's following a cancer diagnosis and treatment. Good. Well, maybe maybe they're changing their ways, but like literally the surgeon just filmed another video of them calling her again to deny a hospital stay after a breast cancer surgery. So Kim says, what are your thoughts on posterior nerve stimulation for an older adult, 60 above with IC? I think it would be an outstanding option to do. No surgery, no anesthesia. If you're trying to remodulate nerves, go for it, girl. Okay, Facebook, you can start typing again. Thank you. I know I missed stuff. So if you ask me a question and I missed it, please type it again because Facebook is doing its normal thing. Let me just see if I can go back because there's like 20 questions I missed. Carrie says, I'm doing physical therapy for my back. It's core work. Oh, yeah. Okay, that's right. We did that one. Vicky says she's losing her mind. Why? Okay, somebody said vaginal Valium suppositories work. They do. Rectal suppositories work for men too. Hold on. Just like, oh my goodness gracious. I am just a little exact. Okay. Oh. I can literally just scrolled all the way to the beginning and then it pushed me all the way to the end in just a second. All right, I'm screwed. Okay, so go ahead and take your questions. If you have questions again and I miss them, I'm sorry. It's just Facebook isn't cooperating. So go ahead and ask them again. In the meantime, Super Bowl Sunday. Okay, so I know it's the Kansas City Chiefs versus the Eagles. My beloved 49ers are not playing. Because I am a California girl, very proud of it. Born here, born and raised in California. What is your IC friendly snack? What are you going to eat? What are you going to eat if you're watching the Super Bowl? So what are IC friendly Super Bowl snacks? Well, whoops. So we're going to stay away from salsa, right? So we don't want to do anything spicy. So avocados, usually IC friendly. So if you want to have guacamole and chips, as long as you haven't put hot spices in the guacamole, you should be good to go. Refried beans and chips, you should be good to go. Refried beans, what is it? What's the name of the company that makes the refried beans? I can see it in my brain. It's not Contadina. What is it? Anyway, refried beans should be perfectly IC friendly. If you want to have sourdough bread with cheese on it, should be fine. I would step away from salami. I would step away from deli meats that are hot and spicy. If you're going to have pizza, go for, you can do a white sauce pizza. White sauce is better than tomato sauce for some of you, especially those of you who have Hunner's lesion. So what kind of pizza is the best pizza? A white sauce pizza, maybe with chicken on it and some veg. That would be good. If you're gonna do anything like pepperoni, anything like that, hopefully you got some pre-leaf. Use the pre-leaf to try to reduce the acid of that. A hamburger should be fine. Remember, acid irritation in the bladder, if you are in the bladder sensitive phenotypes, which is Hunner's lesions, estrogen atrophy, maybe chemical injury of the bladder, it's all about the quantity of acid. So you might be able to get away with a slice of tomato. There's very little acid in a slice of tomato as compared to a cup of tomato sauce. So if you want to have a burger with tomato on it, a little bit of onion on it, I don't see any problem with that, provided you're not in a big flare and provided you don't have Hunner's lesions. If you got Hunner's lesions, you got to leave the tomato behind. But can you have hamburger? Yes. Can you have a roll? Yes. You should be able to have a hamburger bun. Can you have a little bit of onion on it? You know, a couple little tiny pieces of onion? Probably. As long as it's white onion or pink onion. A little tiny bit. Pickles, not so hot on pickles. Pickles, acetic acid, that's going to irritate your bladder. What are some of the other big Super Bowl things? 5-layer dip. You know, it's going to be spicy. I'd pass on it. Straight avocado. Straight refried beans. A little bit of cheddar cheese should be fine. A little bit of jack cheese should be fine. No spicy cheeses. No hot spicy cheeses. Gay said chips and ranch dip. Absolutely. Penny is asking, what is PTNS? PTNS is post-tibial nerve stimulation. PTNS is an option against neuromodulation, or it's a form of neuromodulation, but it's not surgical. So it's not interstem. It's not axonic. It does not involve any incisions, nor is it implanting any electrodes up by your spine. The theory behind neuromodulation is that it works to re-regulate dysfunctional nerves. So neuromodulation became very popular about 20 years ago, 10 years ago. It was kind of marketed to doctors as, you know, those patients who drive you crazy because they're flaring all the time. You can get rid of them all if you just give them this nerve stimulator. It was kind of a Darth Vader approach to IC, to be quite honest. The patient groups back then, we were all kind of appalled at the messages that were being said directly and indirectly about IC. But anyway, it became quite popular. However, our last meeting 2 weeks ago talked about this. There are 44,000 adverse events as of 2021 filed against Interstem, the most popular neuromodulator, including 20 fatalities. And so, if you knew that the high level of adverse event, I mean, roughly 300 a month are filed, even now. That's a lot of adverse events that a lot of patients don't know about. And I believe in something called informed consent. I believe that it's very, very important that if you're considering a major surgical procedure as a treatment, that you understand the risks of that surgical procedure. And one way of doing that is by looking at the adverse events. And so if you go back and watch our last meeting, I talk about that. I also have a video that I've cut from that I haven't put up yet to kind of shorten it a little bit. I think the window for neuromodulation, now that we're phenotyping, doesn't make as much sense, because neuromodulation is not going to fix a wound in the bladder. It's not going to fix a Hunner's lesion from a virus. It's not going to fix a Hunner's lesion from a ligament pulling a nerve down. It's not going to fix estrogen atrophy. It's not going to fix tight pelvic floor muscles, and it's certainly not going to fix widespread pain. And so the window for neuromodulation The ideal market for neuromodulation is somebody who's incontinent. If you have fecal incontinence, if you have urinary incontinence, it's completely out of control. That's where neuromodulation is absolutely life-changing because fecal incontinence is terrible. I was teaching a class years ago. Before I became a support group leader, one of my lifetimes, I was a nonprofit executive and a nonprofit fundraiser and trainer. And I was teaching a class at a nonprofit conference on public relations for nonprofits. And my co-teacher and I, Kim, we were like, give us anything. We can make anything good. And somebody raised their hand and said, okay, what are you going to do for fecal incontinence? And I was like, damn, yikes. That's a hard one. But this is a happy story because now we have a technique that can calm those nerves and control those nerves that cause incontinence. So I think the only window, the most logical patient for neuromodulation is somebody with what we call frequency urgency syndrome, where there's a very clear dysfunction of the nerves in the bladder wall. It's certainly not approved for pain. And you just have to have your eyes wide open if you're considering it. Kim says, thanks, Jill, for answering and for all you do. You're welcome, honey. I love my job. I'm happy to be alive and doing it. Gay says she has the axonics implant with great success. Excellent. So, Gay, what is your phenotype? Just out of curiosity. You're welcome, Penny. You're very, very welcome, hon. All right. So here, hold on a sec. Let me open up this real quick. So we've been going for an hour and a half so far. Sometimes we go an hour, sometimes we go 4 or 5 hours. It just depends upon you and the questions you have. But I know that people are getting ready. The Super Bowl starts in an hour. So go ahead and ask your questions while you have them. Okay, hold on. Is this my mouse for this computer? Yep, there it is. So I am working right now. I've been working this week on doing a new flare guide. All new flare guide based on phenotypes. Really, really happy about that. And really taking a look at flares from a very new perspective, providing hour by hour rescue plans. It's really helping. And so again, think about the patient with a lax ligament that's pulling the nerves down, that's causing all these urinary symptoms, and they're flaring. You're flaring because you walked around the block. So what's your flare rescue plan? So you're having all these urinary symptoms, frequency, urgency, but those nerve impulses are not coming from your bladder wall. They're coming from your visceral plexus that's pulled out of shape because you got a damaged ligament. So how are we going to provide a good flare management protocol for somebody who's flaring from that? And the answer is to sit down and to not let gravity pull on that nerve. And until that nerve is stabilized in some way, gravity is going to give you flares. Walking has the chance of giving you flares. I mean, it's really fascinating how we're looking at this. So how would, so estrogen atrophy flares are easy because those are going to be the food flares. For the Hunner's lesion patient, if you've got a viral infection in your bladder and the virus is active, you're going to be flaring. So your bladder is going to be very, very vulnerable to food. So following the diet's really good. Um, and again, let me just provide this context here. Hunner's lesion patients face very unique challenges that most of us don't have because they have visible bloody wounds in their bladder. And the real question is why? Why do they have a wound in their bladder? Now we have two proven sources of Hunner's lesions. The first one is a viral infection. The second one is ligament laxity causing neuroinflammation. So anyway, I'm being challenged by it. Lori said, you purchased the lactoferrin, then your doctor said because you have pancreas problems, you absolutely not take it. So make sure to always check. The studies are great, but still not for everyone. Okay. That's interesting because in all the lactoferrin research I did, I didn't see any mention of pancreas issues. And I looked at, gosh, probably 24 studies. Let me look. Let's look at that. Oh, okay. So lactoferrin may be elevated in patients with pancreatitis, and it may be involved in the formation of pancreatic stones. And they're not correlated with alcohol consumption or insufficiency. And yet, here's one that says it may improve pancreatic dysfunction and hepatic insulin resistance. Yeah, there was a study in 2022 that lactoferrin improves hepatic insulin resistance and improved pancreatic dysfunction by reducing oxidative stress and inflammation. Ah, you're damned if you do, damned if you don't. Lori, if you got it from us, if it's not open, send it back and we'll give you a refund. You can call me. Anne says, can I have my friend call you? Yes, of course. Lori says, can Dandy Blend be flaring? I really love the taste. Just think it may flare me. It's never flared anybody that I'm aware of because in Dandy Blend, it's low acid and no caffeine. I'd be shocked if you flared from it. I think the only people who could potentially really flare from Dandy Blend would be somebody with massive Hunner's lesion. Sherry says, do you have to alternate feet for PTNS treatments? Well, when I had PTNS, they put the needles in both ankles and then they attached the stimulator to it and they looked at which toe responded. So the way you know they're hitting the correct nerve is by looking at what your feet do when they turn the neurostimulator on. So normally, so if this were your foot, if the tibial nerve is turned on with the TENS unit, the big toe bends down. The big toe will bend down. This one might bend down a little bit, and then these flay out like that. So regardless of whether it's inner stem or ankle stem, when they turn the device on, they look at what your toes do. And again, my doctor was the guy who invented it. And so he was very, very precise. And so he would put a acupuncture needle by my left ankle and by my right ankle. And then he attached the TENS unit to it, turned it on, and watched what my toes did. And then we picked the side that had the best toe response. Now, the other company, Urgent PC, so the company that he worked with, unfortunately went out of business, or they went bankrupt. And so a new company stepped forward to do it. And that's a company that now makes Urgent PC. And they didn't I worked with many patients who had it done. They're not as precise as Dr. Stoller was. So they don't look for the big toe bending down like Dr. Stoller did. Um, I will say, so I did it like 11 times in his office at UC San Francisco. Then they gave me tattoos on my ankles and they taught me how to put the acupuncture needle in. So I did it at home for about a year. Um, um, I will say that over time, the skin got more sensitive, but it was never agony. It wasn't even sharp pain. It was just a little bit more sensitive. The thing you have to remember about any form of neuromodulation is it should never hurt. You never turn it up to the point that it hurts. Some people do that. You think the higher the nerve stem, the better it's going to do it. No, that will actually damage nerves. And so I was working with one nurse who, this was years and years ago, who was going to do it. And she talked to Dr. Stoller and she talked to me. And I said, don't turn it up. Don't turn it up. It's not supposed to hurt. If it hurts, you have to turn the volume down or the intensity down. And what did she do? She ignored all of us. And she ended up with nerve damage. I mean, she was specifically warned several times by the doctor. And then she called me to validate that. And I said, hell no. If it hurts, turn it down. For those of you who are joined, this is de-alcoholized wine. There's no alcohol in it. So you can have it for Valentine's Day. That's why I'm sharing it with you. The brand is Free, F-R-E, and it says alcohol removed wine. So try it. There are alcohol removed white wines, red wines, Zinfandels. There are alcohol removed sparkling wines. This one that I love, it's called Zilch, a sparkling wine. They're about $10, $12. Diane says, I have a new urogynecologist who believes I have Hunner's lesions while the last didn't. The new doctor read the surgery notes from a hydrodistension I had with the first doctor. That's why. The first doctor notes showed a normal bladder with asterisk, after which he defines the accuracy. He said after hydro, there were glomulations and hypervascularity, and there were a lot of areas of bleeding. Okay, so how long ago, Diane, how long ago was it that you had that hydrodistension? Because it would not be unreasonable to let the second doctor look again. Because the thing is if you do have Hunner's lesions, they need to be treated. Untreated Hunner's lesions are the number one cause of very severe long-term pain in the IC, in some, about 5% of IC patients. So if you're a patient with lesions, we want to get that treated correctly. And the way they do that is by doing a cystoscope or a hydrodistension with cystoscopy. They can do what we call narrowband imaging, a flexible cystoscope in the doctor's office. If they have the right equipment, they can use that to actually look in your bladder in the office without stretching your bladder with water. But if they find the lesions, they're still going to have to do a hydrodistension to treat them. And they'll either be injected with a steroid, they'll be cauterized, or you can try the lactoferrin, because we've got good lactoferrin research now showing that lactoferrin has been helpful for Hunner's lesions. But lactoferrin has been helpful for patients without lesions too. Janelle says, does Free have sugar in it? Let me look. The sophisticated alternative, with its delicate pink hue and lively strawberry and citrus flavors, Our alcohol removed rosé makes any occasion special. Crisp, fruity flavors mingle with ripe berry notes, leading to a beautiful, refreshing finish. Mhm. It's got, okay, it would be helpful if I had my reading glasses on. It's got dealcoholized rosé wine, grape extract, natural flavors. Yeah, no, there's no sugar added to it. Any of the sugar in it is coming from the grape, the wine grapes. Okay, so Diane says the first doctor then cauterized areas of bleeding, and there were a lot. This confused my new urogyne because he wouldn't cauterize petechiae, so he thinks they were lesions. I don't know what to think. Well, some of those old school doctors kind of went for broke and they just cauterized everything they could see, even if they were apparently mild. But you don't know. And there's nothing worse than not knowing. And you need information. And the way you're going to get that information is by letting somebody look in your bladder. I wouldn't be afraid of a cystoscopy. If they can do an in-office cysto without stretching your bladder with fluid, if they have the right equipment, that's an easy in and out procedure, like 5 minutes, one and done. It's important to let them look if you've got a weird history like that, especially if your symptoms are getting worse or you're struggling. I mean, if you're in pain every day, if you're not sleeping through the night, something's happening. Don't force your doctor to guess. You deserve more than a guess. You need facts. And there comes a point in time when looking in your bladder is the right thing to do. So I've had 3 total bladder procedures. I had 2 cystos in the doctor's office. My bladder was always normal, despite the fact that I had terrible symptoms. Whenever they looked in my bladder, it was perfect. And then my last one was 7 years ago when I had a hysterectomy and they did a hydrostension with cysto to make sure they hadn't accidentally damaged my bladder during the hysterectomy. And he took pictures. I have a literally beautiful bladder. There was one tiny little red spot on it, little tiny, like a little tiny small pimple. That was it. Everything else looked good. And at my post-op, when he gave me all the pictures, and they're somewhere, I lost them. They're somewhere in my file cabinet back here. He said, Jill, this proves once and for all that your symptoms were never from your bladder. You have a perfect bladder. Your symptoms come from your muscles and nerves. And so having them look in your bladder accomplishes 2 things. It can rule it in, or more importantly, rule it out. Because if you have a normal bladder like I do, then there's no reason to do bladder therapies. Now we have to get to the underlying root problem of why you're struggling with urinary symptoms. Is it tight pelvic floor muscles? Is it ligament laxity? Is it a fibroid tumor pushing on your bladder? Is it endometriosis attached to your bladder? Is it a Charlov cyst? There are lots of things that can trigger the symptoms that you associate with your bladder. But the proof is in what it looks like. If your bladder looks perfect, it's perfect. Celebrate that. It's very confusing. I was very confused. How could I possibly have a normal bladder when I'm getting up every 20 minutes all night long? Well, now we know why. Because my muscles were screwed up badly, and that was affecting my bladder. So don't be afraid of having a hydrodistension or at least having a cysto, because it's really good, valuable information that will help you make good, informed choices. but you have to vet your doctor and talk to your doctor about the procedure, how they propose to do it. Your doctor's experience level matters. Have they done it a lot? And I think a really important question to ask your doctor is, have you had any complications after doing this? That's the one thing we can't predict is that skill level of your doctors. But cystos are just routine, simple procedures. In and out. It's just a quick looky-loo. And the thing that gets messed up after a cystoscopy is your urethra. Your urethra is going to burn. First couple of times you pee after they put an instrument in your urethra, it's not the funnest thing in the world, but literally you have to bite your lip and pee through it, and it calms down fairly quickly. Janelle says, do I do pelvic exercises at home? I do my wand at home. I have a wand that I use for massaging my pelvic floor muscles. And then I have a yoga mat that I do all sorts of other things to just work on my overall health anyway. So yeah, man, you can listen. You don't want to be dependent on somebody else when you have a flare, because you might not be able to get into physical therapy for a month, which means you're going to have a flare for a month. It's important that we learn independence here. It's important that we learn the skills so that when we start to flare, we can get in there and nip that flare in the bud. And the pelvic floor muscles, it's really easy to figure out when your pelvic floor muscles are messed up because you see it based upon how you pee. If you can pee like a horse, you're good. But if you can't start your stream 5, 10, 15, 20 seconds, you're not good. That means we got a problem with a muscle. And, since my surgery, I have had twice now incontinence when I wasn't feeling well, and it happened again a couple mornings ago where I felt like I was starting to leak, but I was steps from the toilet. So I just sat down on the toilet. I find that when I am upset and stressed or ill, that every now and then I might have a little leak. But the other thing that's kind of weird that happens sometimes, and I don't know if maybe any of you can relate to this. Sometimes my muscles get so tight, it's like the skin down between my legs gets hard. Like there's no flexibility. The muscles are just locked up tight. And that's usually from stress for me. And I've got to do my deep breathing and I've got to relax it. And just go to our website. The phone number is on the website. It's in the back too, but it's covered up by the light. 800-928-7496. Just know that don't call try not to call after 2:00 because that's when I usually take over some of the phones when my staff leave. My staff start early. They start at like 6:30 or 7 and they leave at 2. I usually start at like 9 and I leave at like 5. Somewhere in there. So Lori said, it's not open. There should be a PO box right on your invoice, or just go on over to the IC Network website, go on to the returns page, and we have the return address. I can give it to you. It's PO box. Here, I can write it in here. ICN returns. PO box. There you go. So if you can just, if you have your sales receipt, if you can just put a note on it and say that Jill authorized the return. And if you can just put a note on it too, and just say that your doctor didn't want you to take it, so that we don't mix it up with other people, that would be great. And I will make sure to note that in on our website. So Diane says the new urogyn wants to do cystoscopy and steroid injections into the bladder. Okay, can this help if the bladder doesn't have lesions but is severely inflamed? It might. It might. But we have to ask ourselves, Diane, what it is that's inflaming your bladder, and ultimately it goes back to what is your phenotype. So, how old are you, hun? And how old are you now? And how old were you when your symptoms started? I just with that question, it can become quite easy to begin the phenotyping process. So if your symptoms started after a hysterectomy, Lupron, or just as you got older, if your symptoms started in your 40s, 50s, or 60s, then there's a very, very good chance that your symptoms are being driven by estrogen atrophy. So think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste because urine is body waste. Urine contains ammonia and urea. So how can the bladder hold ammonia for hours at a time and not get damaged? It's a real evolutionary marvel because the way the bladder protects itself is with a really thick coating of mucus. So your bladder is like your mouth. It's a hollow organ that's very wet on the inside. And there's this really thick, robust coating of mucus, which is hydrophobic, and it pushes urine away from the skin. It pushes urine away from the nerves. So mucus is important. Dry mouth hurts. Dry bladder hurts. That tissue is meant to be moist. Unfortunately, that mucus production is estrogen dependent. So when you're young and have a lot of estrogen, you have a lot of mucus. Those cells need estrogen to produce mucus. So when your estrogen levels drop because you're on Lupron or you've had a total hysterectomy or you're just getting older, mucus production slows. The bladder wall thins. The mucus on top of the bladder wall thins. And your bladder's ability to defend itself is now greatly compromised. So that estrogen atrophy bladder, what we call that is genitourinary syndrome of menopause. That older estrogen atrophy bladder is going to be a lot more vulnerable to food than the bladder of a 20-year-old because you just don't have the protection. That's not a disease. That's just the lots of estrogen. And so your bladder could be very, very inflamed because you don't have the mucus you used to have and you're drinking a lot of coffee. It's that simple. Or green tea or black tea or soda, or if you're taking a multivitamin, or if you're drinking lemonade or citrus or alcohol. An estrogen atrophy bladder is a bladder that's fairly defenseless. And if you pour acid on that estrogen atrophy bladder, it's going to become more progressively inflamed over time. So again, would steroid injections calm things down? Yes, but you have to understand as an estrogen atrophy patient that it's probably being inflamed because of foods you're eating. And so what's the treatment for an estrogen atrophy bladder? Estrogen. When we give that skin estrogen, it immediately plumps up and starts to produce mucus. It's fantastic. So using an estrogen cream can be very helpful to the skin. But the challenge here is even with estrogen, you're never going to have a 20-year-old bladder yet. Now you have an estrogen atrophy bladder that's getting a little bit of help from estrogen. And so therapeutically, what are we going to do for this bladder? Well, we might do well with something that will coat the bladder, a protective coating. So an example of a protective coating is Elmeron. Elmeron basically is a chemical Band-Aid. Of course, but we now know that Elmeron is associated with retinal damage that could lead to blindness and inflammatory bowel disease. So Elmeron is not the option it used to be. So most of those patients have converted either to bladder installation, like a heparin lidocaine installation. The heparin coats the bladder, or you could try some of the supplements on the back wall there, like Bladder Builder or Bladder Rest or Cystoprotect. These are chondroitin-based supplements, and chondroitin, we believe, has a coating effect on the bladder. So in the end, your question is not an easy question, and that is, would steroid injections help a severely inflamed bladder? The assumption is it would be, but we have to figure out why it's becoming so inflamed, and usually that's going to be from diet. Harriet says, I'm already starting to see some results with estrogen cream. Yeah, baby. Love it, love it, love it. Excellent. Good job. All right. Well, we've been going for 2 hours now, and I think people are probably starting to get ready for the Super Bowl. So let's do I mean, I feel good. I'm happy to stay, but you got to give me questions. If we're done with questions, then let us all go enjoy the rest of the afternoon. So let's do a last call for questions. Last call for questions. I fully intend to be here next week. Knock on wood. You're welcome. You guys, if you find these meetings helpful, please think about becoming a member of the IC Network. Make sure you go over to YouTube and you subscribe to our channel, and that they're all recorded on our channel. And I need to get 10,000 subscribers, and I don't have 10,000 subscribers yet. I need more. For me to do more, I need more. So last call for questions. Last call for questions. Oh. By the way, I gotta say, I have been watching. I am in love now with this actor I'd never heard of. His name is Tim Minchin. He's a musician, actor, pianist from Australia, and he played one of the lead roles in Jesus Christ Superstar 10 years ago. Brilliant performance, brilliant musician, and I just happened upon him on YouTube, and he's this incredible critical thinker, one of the smartest people ever. It's fascinating to listen to him talk. But he created a TV show in Australia called Upright that is blow your mind phenomenal. And Upright is about a young man who he plays, who is trying to deliver a stand-up piano from Sydney to Perth across Australia, which is like a 4 or 5 hour drive. And he's a kind of a down on his luck guy who is anxious and struggling emotionally, and the character is a musician. He is a real musician anyway. And he gets in an accident with a young 16-year-old. And they end up traveling across Australia together. And the humor is wonderful. But there's a story underneath the story that is so incredibly, stunningly profound about why is this young man who's driving across the country because his mother's dying, and he's trying to get a piano there, but that's not why he's trying to get the piano there. And it's breathtakingly entertaining and beautiful. And I've been watching it through Apple TV with a 7-week free Sundance Now. Anyway, Upright, look it up. Betty says, foods that contain bees, a problem for IC? No, not usually. Um, that's actually a much more uh, physiologically and bladder friendly way to get your vitamins. The only exception to that are going to be foods that are high in vitamin C, which means they're high in ascorbic acid or citric acid. So doing an orange or doing a lemon might be more irritating if you have Hunner's lesions or estrogen atrophy. But for the Bs, I wouldn't worry about that too much. Diane said it was 2 years ago. So, Diane, whenever you have a hydrodistension, and for anybody out there, it's always important to encourage your doctor to take pictures. Very important to come out of those tests with pictures so that 2 years later, if you change your doctor, you can show them a picture of what they saw. So that's the sad part here is the first doctor apparently did not take pictures. Although you could call the first doctor and ask if they did, maybe there are some pictures in your medical record. If not, you're kind of in the situation where you're probably going to have to let another doctor look in there again because Hunner's lesions can come back and they can be very painful if they come back. So it's important to identify Hunner's lesions early and to treat them early. Diane said, I was taking lactoferrin and had stopped because of bloating and gas, which irritated my bladder. You have SIBO, and you believe the lactoferrin was killing off or activating the SIBO. It was killing it off, undoubtedly, because lactoferrin helps your body normalize good bacteria versus bad bacteria. So the one known side effect of lactoferrin could be exactly what you experience, which is some loose bowel and maybe a little bit of bloating. Lactoferrin is a protein that comes from colostrum that has natural antibacterial, antifungal, antiviral effects. So, and the research behind it is phenomenal. And the research behind it with cancer, the research behind it with IC is rock solid, looks great. That patients who had red inflamed bladders, patients who had Hunner's lesions, patients with systemic inflammation after lactoferrin treatment, the red inflamed bladders became pink and healthy. Hunner's lesions basically disappeared. They were almost completely resolved. That's a direct quote, almost completely resolved. And more importantly, systemic inflammation as measured through blood testing had gone down. And so that IC study found that 28 out of 31 patients who did it had no flares afterwards. And their bladders basically healed. They became very pink and healthy. 3 out of the 31 patients in that study had one flare, but the rest were apparently flare-free. Now, this was a small pilot study, but it was an exceptionally done pilot study because of all the testing that most pilot studies don't do. Just to look in the bladder before and after treatment was very, very meaningful. That's why lactoferrin has become a very promising new way of treating or trying to improve bladder health in IC patients. And it's a simple over-the-counter supplement. But if you have SIBO and you're already messed up down there and you've got a lot of bad bacteria or fungus in there, well, when you give the body something to fight that, the body's going to fight it. And that can cause loose bowel and a little bit of stomach upset. I mean, Diane, it might be interesting to reduce your dose. I mean, I would certainly stop it for a period of time, but I think it would be also equally fascinating to try it again in a couple weeks or a month and see if it did the same thing, or see if by chance the amount that you've taken has helped to control some of that other stuff too. I mean, it's a viable option. All right, my friends. Well, I think we have come to the natural end of our meeting. So I'm going to wish you well And come on over to the IC Network. We've got lots of new blogs up. I got the new Valentine's blog up. We're talking about intimacy, how to make intimacy more comfortable, how to celebrate the day without letting IC mess up your relationships. And we add new content all the time. Every week we have new blogs, even though most websites aren't doing that anymore. They consider that a waste of time and money, but I think education is important, so I'm going to do it. So anyway, all right, my friends, I'm going to say goodbye to YouTube first. If I can get my mouse to work. There it is.